Onc Live Insights is a video editorial program produced by Onc Live.
One of the potential treatment for kidney cancer would be to overcome resistance to VEGF-targeted agents. And we have different approaches to do that. One is to target some of the responsible cytokines to resistance, and one is FGF. Lenvatinib is one of the drugs which has been tested to try to overcome resistance. This drug is both an FGF and VEGF inhibitor. It was developed initially in thyroid cancer, it's active, and it has been developed in kidney cancer in a phase 2 randomized study which was presented at ASCO 2005. It was a three-arm study with a combination with everolimus, a monotherapy arm of lenvatinib, and an everolimus arm. It's only a phase 2 study, so we always have to be very cautious about interpreting or over-interpreting a phase 2 study. But the efficacy of the combination and even of the monotherapy seems to be very good. I mean, it's 14.6 months PFS with the combination with everolimus, more than 7 months PFS with lenvatinib alone. So it seems to be an attractive, efficacious drug. But the toxicity profile also seems to be quite important. A lot of dose reduction, a lot of interruption of the treatment during the study. So both, impression of good efficacy, but also a little bit cautious about toxicity and what's going to happen in the further development of this drug. With lenvatinib, one of the problems was toxicity. So we had almost 75% of the patients who had dose reduction, more than 30% where we had to interrupt the treatment because of toxicity. And if you look at the duration of treatment compared with the PFS, especially in the combination arm, there is a big gap between 7 months duration of treatment and 14 plus months duration of PFS. Which means that both, there might be some biases in this data, which are maybe premature, which are only on 50 patients. So still promising drug, but a little bit of cautious because of the number of patients treated.
So we have one of the new drugs called Lenvatinib, which is also a TKI, but with a broader range of targets that are inhibited, FGF for instance. And it turns out, it seems at least at this moment from the phase 3 data, that it's a really important drug. It seems toxic, but there's a randomized phase 3 study in which Lenvatinib single arm was tested against everolimus single arm against a combination at lower dosages. There are very important things to say about this study. First, apparently the combination, it would be too toxic to take the standard dose of either of the drugs. However, the combination is exceedingly effective. So if you compare Lenvatinib single arm and everolimus single arm and then the combination, it's clear, at least in my mind, that the combination is very favorable as compared to the single arms. So looking at also the curves at this moment, and of course you have to be cautious, it's a phase 2 study, I do think that this combination is probably going to be extremely effective, will make it maybe even more difficult for us to choose from, because of course, say that the phase 3 study would be done, we still don't have the comparison with the other standards of treatment. But I do think that this may be a winner. It's really striking responses, long-lasting responses, and it's interesting because as medical oncologists you tend to combine drugs from different classes, and it was never feasible, was too toxic, and this is, I think, the first time that we're really convinced that this combination might be a winner as well. So, but of course, it's not there yet. We don't have the phase 3 data.